Okay, so this is TOG questions from the July 2021 TOG. I hope you'll find these questions useful as well for your revision. Again, the format is similar where I read the question and then follow that with the answer. If, however, you need more time to think about the answer, then please feel free to stop the presentation to think about the answer. But I'm hoping that this will help with your MRCOG Part 2 and Part 3 revision. Good luck revising. Okay, first question. Which of the tumor markers are raised in yolk sac tumor? Select two from the list below. Is it alpha-fetoprotein, LDH, HCG, inhibin, DHEA? And the answer is alpha-fetoprotein and LDH. Second question, which tumor marker is raised in dysgerminomas? Is it alpha-fetoprotein, LDH, HCG, inhibin, or DHEA? So it's just one tumor marker. And the answer is LDH. Third question, which tumor marker is raised in choriocarcinoma? Is it alpha-fetoprotein? Is it LDH, HCG, inhibin, or DHEA? And the answer is HCG. Fourth question, which tumor marker is raised in granulosa cell tumor? Select three from the list below. Alpha-fetoprotein, LDH, AMH, inhibin, and T. The answer is inhibin, AMH, and plus or minus T. Fifth question, which tumor marker is raised in immature teratomas? Select three. Is it alpha-fetoprotein, LDH, HCG, inhibin, DHEA? So that's immature teratomas. The answer is alpha-fetoprotein, LDH, and DHEA. Sixth question, malignant germ cell tumors account for what percentage of ovarian cancers in Europe? Is it 0.5%? Is it 2%? Is it 1.5%? Is it 1%? Or is it 10%? And the answer is 1.5%. In small cell carcinoma of the ovary, the hypercalcemic type, what proportion of patients have raised calcium? Is it 1%? Is it 100%? Is it 1/3? Is it 2/3? Or is it 50%? And the answer is 2/3. What is the increased risk of VTE in pregnancy compared to non-pregnant women? 100% increased risk, half the risk, five-fold increased risk, two-fold increased risk, or four-fold increased risk? And the answer is five-fold increased risk. What is the increased risk of VTE, which is venous thromboembolism, postpartum? Is it 100%? Is it half? Is it between 20 and 60-fold increase? Is it two-fold increase? Is it four-fold increase? The answer is between 20 and 60-fold increase. What is the mean hemoglobin for the fetus at term? Is it 160? Is it 140? Is it 100? Is it 120? And is it 150? The answer is 150. What is the dose of progesterone in the MIRENA coil? Is it 45 milligrams of levonorgestrel? Is it 50 milligrams of levonorgestrel? Is it 53 milligrams of levonorgestrel? Is it 55 milligrams of levonorgestrel? Is it 52 milligrams of levonorgestrel? And the answer is 52 milligrams of levonorgestrel. Which of the following is UK MEC2? Is it A, a condition for which there is no restriction for the use of the contraceptive method, a condition where the theoretical or the proven risks usually outweigh the advantages of using the method, the provision of a method requires expert clinical judgment and/or referral to a specialist contraceptive provider, since the use of the method is not usually recommended unless other more appropriate methods are not available. A condition where the advantages of using the method generally outweigh the theoretical or proven risk, or is it D, a condition which represents an unacceptable health risk? The answer is a condition where the advantages of using the method generally outweigh the theoretical or the proven risk. What is the percentage of women in the UK who use intrauterine contraceptive device? 14%, 4%, 2%, 1%, or 9%? And the answer is 9%. What is the dose of progesterone in JDES? Is it 45 milligrams of levonorgestrel? Is it 13.5 milligrams of levonorgestrel? Is it 15 milligrams of levonorgestrel? Is it 10 milligrams of levonorgestrel? Is it 52 milligrams of levonorgestrel? The answer is 13.5 milligrams of levonorgestrel. What is the risk of expulsion with intrauterine contraceptive device in the first 3 months of its insertion? Is it 1 in 20? Is it 1 in 10? Is it 1 in 5? Is it 1 in 15? Or is it 1 in 7? The answer is 1 in 20. What is the risk of progression of endometrial hyperplasia without atypia to endometrial cancer? Is it less than 3% over 20 years? Is it less than 5% over 2 years? Is it less than 5% over 5 years? Is it less than 5% over 10 years? Or is it less than 5% over 20 years? And the answer is it's less than 5% over 20 years. What is the risk of fetal loss with parvovirus infection before 20 weeks of gestation? Is it 10%? Is it 13%? Is it 25%? Is it 5%? Or is it 50%? And the answer is 13%. What proportion of women undergoing intrauterine transfusion form additional alloantibodies? Is it 1 in 10? Is it 1 in 2? 1 in 4? 1 in 5? Or 1 in 3? And the answer is 1 in 5. The use of copper intrauterine device reduces the risk of which types of cancer? Select 2 from the list below. Is it ovarian cancer? Is it endometrial cancer? Is it cervical cancer? Is it vulval cancer? Or is it breast cancer? Remember, you need 2 from the list above. And the answers are endometrial cancer and cervical cancer. In ovarian cryopreservation, ovarian activity resumes in what percentage of women? Is it 25%? Is it over 90%? Is it 65%? Is it 55%? Or is it 50%? So this is ovarian cryopreservation when this tissue is reimplanted into the recipient. How many percentage of women do ovarian activity resumes in? That's what the question is referring to. The answer is it's an over 90%. Thank you very much for staying with me and following this series of questions. I go through all the different talks in each issue to be able to come up with these questions. I've used these questions for my revision of MRCOG Part 2, and I would really strongly recommend for you to incorporate questions into your revision and learning, because that's how you will be able to cover the breadth of the syllabus, because there is quite a lot of topics to get through, especially for MRCOG Part 2. So please use these questions and revise from them as many times as you like. And if you've got any improvements or any suggestions, then please leave them in the comment below, and I shall respond to it as soon as I can. Thank you.